During this case study, I will not be addressing the client by her first and last name for the simple fact of confidentiality. However, I will be explaining why the client was referred to Rocky Mountain Behavioral Health, an outpatient drug and alcohol clinic that deals with individuals who are involved in either probation due to criminal history and substance use or in DHS after a dependency and neglect action has been opened. I will be also addressing the problematic factors in her life, her strengths, as well as her current treatment plan, and different ways that we can help her address some of her issues. First of all, the client is a 24-year-old Caucasian female who is currently living in a studio apartment with her boyfriend as well as a disabled veteran who is unable to care for himself. She is his caregiver. She was referred to Rocky Mountain Behavioral Health by the Department of Human Services in Fremont County after a dependency neglect case has been opened due to her continued substance use and the removal of her child due to her substance use. She has engaged in the Family Treatment Drug Court program, which is one of the specialty courts in Fremont County. They have it also in other counties around the state and other states. The reasoning behind her joining Family Treatment Drug Court is not only for a higher level of support, it's a very intense program, but also because there's a chance that she would be able to receive care of her son again quicker. Her presenting problems at the time of her intake was polysubstance use. At the time of her initial UA, she tested positive for methamphetamines, opiates, as well as marijuana and alcohol. She reported at the time of her intake that she actually hasn't used methamphetamines for over 10 years, which was her drug of choice before she went to prison on a previous case. She reported that she was using heroin daily for over 3 years with her boyfriend. The way that the charge in the dependency and neglect action came about is her and her boyfriend were in their vehicle arguing with each other and somebody called the police. Her son was in the back seat. When the police came, they found substances, needles, bags, and found that they were under the influence of mind-altering substances, so the child was removed. Also, she has a history of substance use over her lifetime. 15 or 16 of her 24 years have been utilized with substance use. This means that she has a history of relapse even after she has obtained sobriety through places like prison or inpatient rehab. At the time of her intake, she did report a history of physical, mental, and sexual abuse from people ranging from her brothers to her father to her foster parents. So there's a significant amount of trauma involved with this young woman. Also, there's a history of substance use in her family. Her mother is an active user of heroin and methamphetamines. Her father, whom she does not have contact with, was abusing alcohol and methamphetamines when she was a child. She was also involved in a dependency neglect case as a youth, so she was removed from her parents' home as well as her siblings due to her mother and father both abusing substances. This makes this case very interesting because she understands the dependency and neglect process, and her mother actually sat with her in meetings with DHS. Something that is interesting as well is the supervisor on her case for the Family Treatment Drug Court was actually her caseworker when she was a child. So the supervisor is very close to this case. Other factors that are presenting a problem with this young woman is her ACE score, Adverse Childhood Experiences, was 8. So she reported that not only did her family suffer from mental illness, but her mother was beat when she was a child. Her mother went to prison. Someone attempted suicide in her family, so she scored very high on the ACE score. She also is in a relationship with a man who is 12 years older than her and who is a violent sex offender 4 times over. He did 5 years in prison for one of the offenses, and he does not have any children right now, and he is not allowed to have any contact with her child. This woman also has minimal job skills as she has not obtained meaningful employment her entire life. She has multiple felony charges for things ranging from drugs to assault, as well as different robbery charges. There are strengths with this individual that need to be recognized. She recently received the Vivitrol shot. This Vivitrol shot has been helping her with cravings and triggers, and blocking any of those cravings. She has been compliant in her treatment. She is in our IOP program, so she is in 4 groups a week as well as 1 individual session with myself weekly. She did obtain her GED while she was in prison, so she does have that credential working for her. She is willing to open up in group and individual sessions about her current triggers, her current struggles. And she recently received unsupervised visits from the Department of Human Services with her son. However, it is an issue for her because her boyfriend of over 7 years is not allowed to be around her or the child without the department present. At this point, he is not allowed around the child even if the department is present because of the concerns that they have surrounding his history of sex offense. Her treatment plan currently, as I said, she is an IOP, so she attends 4 groups a week. One of those groups is a mindfulness group. Another one is a trauma-informed women's group for co-occurring disorders. And the other groups are cognitive behavioral therapy groups. So we're looking to change her thought process or help her understand how her thoughts can lead to her actions and behaviors, which usually resulted in substance use for her. She is currently, as I said, in the family treatment drug court process, and in the program. So she receives 5 visits from DHS weekly. So she has to make contact with DHS weekly and daily in order to be compliant in the program. She's on 2 random UAs a week. As of right now, her UAs have been clean. Also, she is seeking to obtain employment, so that is part of her treatment plan. In order for her to continue to maintain sobriety, we need to make sure that her basic needs are met, which could include food, housing, things of that nature, and an ability to support herself and her child. Also, she needs to seek out safer housing. She's currently living in an apartment where water leaks from the ceiling, and her previous drug dealer lives upstairs from her, from the apartment, and that's the apartment that the water is leaking from. So we want to be able to empower her to seek out her own employment. She is asked to learn and apply refusal skills to high-risk situations. She is at a very high risk for relapse at this point. This is the longest sobriety that she has had in the past 10 years, so we are very aware of the triggers that are taking place in her life and trying to help her avoid the high-risk thinking and the high-risk behaviors. She is also encouraged to learn and apply boundary setting skills, not only with her current relationship, but with her friends that have been in her relationship or been in her life. Considering her mother is an active user and is still involved somewhat in her life, she has begun to set the boundaries with her mother, and has expressed to her mother that she is not willing to have her in her life if she is currently using. 2 theories that are going to be used to help this client. First is group dynamics. I believe that applying her to the group setting and having her express her concerns with the department, being worried about her boyfriend, may allow the group to help her to see that she may not be in a positive relationship. I, however, am going to support her in self-determination, so if she feels that this relationship is good for her, of course I will help her be aware of different signs and triggers for him to reoffend or become violent with her or to relapse. However, it is ultimately her decision to stay in the relationship or not. Also, systems theory is going to be imperative in this case because there are so many individuals that are involved with her life right now. Not only do we have Rocky Mountain Behavioral Health, but we also have entities like the Department of Human Services and possibly the judicial system. So having a more well-rounded approach to this individual to where we are all offering her support in different ways is going to be huge. However, I have been cautioned and have spoke with the Department of Human Services Family Treatment Drug Court team that we all need to be aware of what we are doing with the individual so we don't overstep our bounds and so we don't confuse her ultimately on what her goals are for each entity. There's so many different systems that are involved with this young woman, including her family, including her son, including the different working parts of the dependency and neglect action. So she's a very high risk case. She continues to engage in treatment and the Vivitrol shot appears to be offering her some relief from her triggers and urges. She will continue to stay in the IOP program throughout phase 1 of the Family Treatment Drug Court process. She'll be reevaluated on what groups she needs to be in and what compliance looks like for her as she continues with the program.